This is Dr. Someshwar from Shield Healthcare. I hope everyone doing good. And I welcome you all on to the Menopause series by Dr. Payal Bhargava, a co-founder of DivineMagic Foundation. Before starting the talk, let me take privilege to introduce Dr. Payal Bhargava ma'am, who is a postgraduate diploma in ART from and reproductive medicine from Kiel, Germany. And she did her fellowship in infertility from IMA Hyderabad, and she is a life member of IMA, Menopause Society India, and PCOS Society India. She is a member of Managing Committee of PCOS Society India and co-founder and director on board XPS Analytics Private Limited, and consultant at Sri Krishna Diagnostic Center, and also consultant at Pranada Hospital, Hyderabad. And she is a co-founder for DivineMagic Foundation, a public health and awareness initiative working at grassroots level and digitally through its YouTube channel.
And welcome all for our second episode in the series of Sailing Through Menopause, an awareness series on menopause by DivineMagic Foundation and Shield Connect. Our today's topic is body composition and menopause. So today we'll be discussing how body changes occur during menopause and affect bone health, leads to obesity, which leads to sarcopenia and muscle atrophy and bone pains. So to summarize our first video, life expectancy has increased significantly in the past century, and women spend approximately 30 years of their lives in the postmenopausal period. At this juncture, understanding the health issues of postmenopausal women is of prime importance. At menopause, we have seen there's sharp decline in estrogen production, leading to accelerated physical, physiological, and neuroendocrine aging in women. Estrogen hormone, as we have seen in our earlier video, acts as a superwoman. The deficiency of this hormone leads to multiple problems in women. So today, let's discuss how body composition is affected in menopause and what all it leads to. The change in body composition in menopause is reflected in all the compartments. It affects bone, which leads to decreased bone mineral density, or it decreases the bone health, which leads to osteoporosis. Menopause leads to loss of muscle mass, which leads to sarcopenia, loss of cartilage, which leads to osteoarthritis, where we have joint pains, shift of adipose tissue leads to cardiovascular risk and sarcopenic obesity. Now, as we go further in our series, we'll be discussing each and every topic separately, as all of these are very, very important. Today, we'll be focusing our discussion on obesity, metabolic syndrome, and how it impacts our heart. So obesity is an epidemic in our country. What it is and how we define it. Obesity is an abnormal or excessive fat accumulation that may impair the health, that is cardiovascular, it may affect your heart, metabolic syndrome, and can also lead to multiple cancers. Simplistically, it is an imbalance between the food intake and the energy we spend. So as menopause occurs, there is increase in visceral fat. What is visceral fat? Let's see further as we progress in our episode. So there's age-related decline in metabolism. The role of central obesity reflects increased visceral fat and or ectopic fat, which is stored in liver, muscle, pancreas, and epicardium, linked to the development of insulin resistance and metabolic syndrome. So how can we measure obesity? How can we know whether we have normal weight, or we are overweight, or we are obese, or we are really very obese, and immediately we need to do something about it? So obesity is measured by a scale known as the BMI or basal metabolic index and waist circumference. The BMI is calculated by dividing person's weight in kilograms by their height in meters squared, commonly expressed as kg per meter square. So this is something which is very easy and each and every one of us can do at home. All of us have smartphones, and in that, if you type how to calculate BMI, you'll get the formula in which you can put your weight in kgs and your height in meters square, and you will get what is your BMI. The other important formula by which we can measure how obese we are is by measuring our waist circumference and the waist to hip ratio. The waist circumference divided by the hip circumference, along with BMI, are used as more sensitive indicators of disease risk. Based on our BMI, a staging system is used to assess risk and plan the management of our treatment. So obesity, if it is more than 80 centimeters, according to WHO, in the Indian woman, it is considered only more than 72 centimeters. That means that you are obese. And you need supervised weight management if your waist circumference comes to more than 80 centimeters. What are the consequences of obesity? If we don't treat it, what it leads to? Obesity leads to diabetes, it leads to blood pressure, it leads to liver disease, it leads to reproductive disorders, heart disease, mood disorders, cancer risk, and dyslipidemia. And the worst of all, it leads to depression and body consciousness. So BMI in kg per meter square is category and management. Now category and invention according to WHO and Indian scenario of women are: you are considered underweight if your BMI is less than 18 and it encourages balanced diet and exercise. For an healthy individual, according to the Indian scenario, the BMI between 18 to 22.9, you should encourage balanced diet and exercise. For an overweight woman, that is when the BMI is between 23 and 24.9, you need to consider lifestyle management, that is diet, exercise, and behavior therapy. Grade 1 obesity is when your BMI is more than 25, that is lifestyle plus drug therapy if comorbidities like blood pressure, diabetes, or other problems coexist. The grade 2 obesity is defined when the BMI is more than 35 to 39, lifestyle plus drug therapy if comorbidities exist. Then bariatric surgery is suggested. For grade 3 obesity, lifestyle, drug therapy, and bariatric surgery is recommended. Coming to menopause and insulin resistance. As we have seen till now, menopause is associated with unfavorable changes in the biochemical markers of CVD, as well as with the deterioration of glucose tolerance, factors that are likely to increase the incidence of heart disease. These changes are in part due to the age-related metabolic impairment, but may also be associated with postmenopausal hypoestrogenism. So what do we mean by this? Exactly what I'm trying to communicate here is, as we age, our resting metabolic rate slows down. The food that we used to eat earlier and used to get digested faster the digestion has become very, very slow, and that food changes to fat in our body and stays with us. So the main factor for this is aging, as well as the low levels of estrogen in our body due to postmenopausal phase of our life. So the sharp decrease in circulating steroid hormones seem to reduce both insulin secretion and elimination. So what all these things do is they reduce the insulin secretion in our body and also the elimination of fat, as well as to increase insulin resistance, thereafter bringing about an increase in the circulating insulin concentration and a higher incidence of both type 2 diabetes and metabolic syndrome. So as we see aging, obesity, decreased metabolic rate, and less of estrogen at the time of menopause lead to type 2 diabetes and metabolic syndrome, which affects the functioning of the heart in our body and leads to heart attack. So insulin resistance is associated with a number of metabolic abnormalities, including glucose intolerance, dyslipidemia, and central obesity, the metabolic syndrome, which predispose to CVD, diabetes, mellitus, and some cancers in our body. The incidence of many of these conditions increases after the menopause, a time when insulin resistance also increases. So as we age, insulin resistance will increase. The food, as I have told you earlier, we are not able to digest. There's glucose intolerance, that is, there's increase in the level of blood sugar. Dyslipidemia is when your cholesterol, triglycerides, LDL, all these are very high. Usually when you go to a doctor, they will suggest after a certain age, a complete parameter and a body checkup for you. That includes lipids also, or the lipid profile, which has all these tests, and they show abnormality after a certain age. And if you are centrally obese, that is, if you have more of visceral obesity, then these factors have a very drastic effect on your body and may harm you in very many ways. So all these things lead to diabetes, heart disease, and cancer in the body. So what are the symptoms of insulin resistance and how can we identify it early? So during post-menopause, what we see is, as I have discussed earlier about the central obesity, this is something called as acanthosis nigricans and is very, very common in obese as well as insulin resistance patient. Here you will see darkening of the skin, and these are small skin tags which are very, very common after a certain age and indicate that there is insulin resistance. There will be sleep disorders, stress disorders, and high cholesterol levels. So the management guidelines suggest a combination of counseling, lifestyle modifications, and drug therapy for these patients. Now, postmenopausal women are a greater risk, as discussed earlier, for developing type 2 diabetes. So how does this happen? The risk factors for insulin resistance are overweight, where your BMI is coming to more than 25. There's physical inactivity. You are sitting most of the time, either in front of your laptop, or you are physically inactive, not going out for a walk or exercise as it has happened during the time of COVID. Your age is more than 45 years or older, a history of glucose intolerance or gestational diabetes. Gestational diabetes is when you get diabetes during the time of your pregnancy, or there's a family history of diabetes in your parents, then you are more prone for postmenopausal women diabetics conditions. Existing type 2 diabetes, blood pressure or heart disease, elevated triglycerides, that is low high density lipoprotein, which is protective towards the heart, and increased level of LDL. Acanthosis nigricans, as we had seen in the picture, which is characterized by dark velvety patches caused by insulin buildup in the neck and the armpits. You have history of polycystic ovarian syndrome and non-alcoholic liver fatty disease. So that was all about insulin resistance. Now, insulin resistance, if not taken care of in the initial stages, further leads to metabolic syndrome. Metabolic syndrome is very, very common in our country. Almost 50% of the women in postmenopausal age group suffer from metabolic syndrome. What is it? So metabolic syndrome refers to a constellation of factors that increase an individual risk of heart disease as well as type 2 diabetes. It is a metabolic disorder characterized by blood pressure, hyperglycemia, and hyperuricemia. It was found that insulin resistance and obesity were directly linked to this clustering of metabolic risk factors that predispose an individual to CVD and type 2 diabetes. So here we have a beautiful picture of a woman showing all the features of metabolic syndrome. There's lack of physical exercise, she has depression, she has heart disease, she snores, she has sleep apnea, her blood pressure is high, she has dyslipidemia, that is elevated levels of LDL cholesterol and decreased level of HDL cholesterol. I would repeat here that high levels of HDL are protective towards you getting a heart attack. There's type 2 DM, she has gallstones, CKD in type 2 diabetes. There is liver cirrhosis, again due to fat. Then there's DVT or leg edema is there. Life expectancy is usually reduced in these women. So the prevalence of metabolic syndrome in our country is reported to be around 22.2% and rising continuously, and is now expected to be around 48%. It is 1.5 to 2 times more common in women. The metabolic syndrome is also known as insulin resistance syndrome or syndrome X, and an average of 40% of Indian women are suffering from it. So it is of prime importance that we understand what metabolic syndrome is, what insulin resistance is, and what are the features that suggest diabetes, and we try to control it as early as we are able to get any of these features instead of letting it affect our body dangerously. So the features of metabolic syndrome are, again, I would like to repeat, it is a central obesity, which is very, very important. We have a lot of patients and women coming us that we never had a tummy earlier, and now as they are aging, it is coming out and they're not able to get rid of the fat on the tummy. Insulin resistance, as I've described how it is, then dyslipidemia, that is, again, I would like to repeat, increased level of triglycerides and LDL cholesterol, elevated triglycerides, small dense LDL particles are there, reduced HDL, there's high blood pressure, hypercoagulable state, and pro-inflammatory state. Now, this hypercoagulable state and pro-inflammatory state lead to heart attack and brain stroke. So what are the criteria by which we can say this patient is suffering from metabolic syndrome? When you have a waist circumference of more than 80 inches in an Indian woman, 80 centimeters in an Indian woman, and according to WHO for the other countries, the criteria is more than 88 centimeters or more than 35 inches. Triglyceride level of more than 150 milligram per deciliter, high density lipoprotein of less than 50 milligram per deciliter, lipoprotein of more than 130, blood pressure of more than 110 milligram per deciliter, and fasting glucose of more than 100. So coming to the take-home message of today's presentation, lifestyle factors play an important role in insulin resistance, and potential contributing habits should be a priority in the management of insulin resistance. Routine monitoring of body weight, especially the index for central obesity, blood glucose levels, lipoproteins, and blood pressure are recommended. Weight loss of 5 to 10% by moderate calorie restriction is recommended. A weight reduction of as little as 5% of current weight is sufficient to improve many of the abnormalities associated with the insulin resistance. So dietary composition should include a healthy, balanced diet based on suitable foods and calorie intake, particularly from fats and refined carbohydrates. Dietary modifications with low glycemic index food and increasing fiber intake can help to limit the untoward metabolic consequences of insulin resistance. A 20 to 30 minutes of exercise at least 3 times a week has been shown repeatedly to improve insulin resistance, reduce hypertension, and improve HDL and LDL ratios. In women for whom lifestyle change is not enough, and who are considered to be at high risk for CVD, drug therapy may be required to treat the insulin resistance syndrome. Several classes of drugs, all with advantages and disadvantages, are currently available. Choice of medication should be individualized. It is different for each and every patient. So to sum up today's presentation, there are certain body changes that occur during menopause, which lead to increased obesity, central obesity. This central obesity or the visceral obesity is very, very harmful for our body and our heart. It leads to various problems. One is it affects our bones, it affects our heart, it increases the chances of us getting blood pressure, diabetes, and other lifestyle disorders. The most important of all of them is metabolic syndrome. When you have central obesity, that there's raised blood pressure, raised lipid profile, and diabetes also. So this presentation was to create an awareness about all these diseases, as these are just lifestyle modifications, and if you are aware of them, you'll be able to take care of all these problems as soon as the problems start, instead of when it has really progressed and you need medication or maybe hospitalization or surgery for the same. So our next topic for discussion will be diet in menopause. As we have seen, most of the problems that we face during menopause can be managed just by lifestyle modifications. So we'll be discussing about diet in menopause in our next episode. Thank you so much for your patient hearing.